introduce myself. I'm Bill Sefakar. I do want to tell you about this man, Dr. Koren. His 20th book, Best Practices for Environmental Health, Environmental Pollution, Protection, Quality, and Sustainability, is the first of its kind in the world, holds an Amazon 5-star rating, and is recommended by the National Environmental Health Association. So without further ado, let me present you this very dear man, very dear friend, Dr. Koren.
There's another author sitting here beside me, Bill Sefakar. He just published a very loving tribute to his immigrant parents and their highly significant accomplishments. That's entitled American Dreamer, A Look into the Life of My Father, Joe Baby. His father served in the Second World War. My parents were also immigrants. My dad arrived in 1910 at age 16. When he arrived at Ellis Island, he fell on the ground and kissed the earth. And in 1917, he enlisted in the First World War. They sent him home to die. He had influenza, so he had a medical discharge. Got better, and he enlisted a second time and had a honorable. The words global warming elicit an immediate political response. This discussion is not about Democratic or Republican politics or political positions. It's about all of us being citizens of the United States of America and citizens of the world. And what kind of planet we will present to future generations, and what effects pollutants, science, and global warming has on the public's health and welfare now and into the future. Science is under attack today, including environmental science. This attack increases the imminent danger from pollutants, emerging diseases, and global warming, resulting in potentially sharply increased sickness and death. Today we're going to talk about how the combination of environmental pollutants, emerging and re-emerging diseases, vulnerable populations, global warming, and silencing science are all interwoven, may create increasing levels of disease and early death, while the pollutants damage the natural environment for us and for future generations. The solution is to become environmentally literate and use evidence-based practices. These are best practices, as in my 20th book here, from thousands of field practitioners to resolve these problems. First, I'd like to relate this story. In 1891, in Terre Haute, Indiana, I was their historian for 14 years. An old man who's age 72, because I'm older, I'm 84, dedicated the first Reformed temple in the area and told the story, which is very meaningful today. His name was Rabbi Isaac Mayer Wise, the founder of the Reformed Jewish movement in the United States. He said, quote, "An old man was sitting beside the road planting a seed to grow a tree. A young man came up to him and said, 'Old man, how foolish you are. You'll never see the seed become a tree.' The old man pointed across the road at the grove of trees and said, 'Do you see these trees over there that provide you with shade and fruit and something pretty to see? They were planted by old men like me.'" Ladies and gentlemen, I'm that old man at age 84 that is here to plant a seed for all of you to nurse and take care of until it grows into a grove of beautiful trees. You too will do the same for future generations. When we talk about pollutants, we have to also talk about evidence-based practices. These are best practices. I'll explain this to you. Pollution is the largest environmental cause of disease and death in the world today, responsible for an estimated 9 million premature deaths in 2015. 92% of all the pollution-related mortality deaths is seen in low-income and middle-income countries. Environmental pollutants are costing the global economy $4.6 trillion a year in annual losses. And that comes from Lancet. It's a journal of medicine. It came out October 19, 2017. Well, folks, because we're asked to discard the wisdom, the training, and experience of our scientists, the EPA's regulations, and the attempt to destroy the Environmental Protection Agency, will become just like low-income countries. People will become sick and die, and our economy will suffer. We are in danger of becoming a second-class country. That's why I came out of retirement to give this presentation. On December 17, 2017, the Center for Disease Control and Prevention officials were told not to use the words evidence-based and science-based in their budget request to Congress. Instead, used the suggested phrase, and this is a quote, CDC bases its recommendations on science and consideration with community standards and wishes. The restriction of words has just started the destruction of the entire science, public health, environmental health, medical science, and all other sciences fields. All of these fields depend on the art and science of the profession, and the art is evidence-based practices. As a college freshman in 1951, I was taught in my laboratory science classes to take copious notes of everything that was done and record the information in a bound notebook. If the experiment was successful, we analyzed it and determined why it was successful. It was unsuccessful, we analyzed it and determined why it was unsuccessful. This is how students have been taught, and this is how evidence-based practices, best practices, are developed. Professionals use the same techniques when conducting various programs to protect the health and safety of our citizens, of all of you. Best practices, these evidence-based practices, are the art of any profession and are extremely necessary to effectively prevent, mitigate, and control disease and injury, prevent premature death like the 9 million people that died, and protect the natural environment. Best practices, plus the use of the knowledge of the appropriate science and technology, are the basis for all regulations. Now it's being proposed that whenever people in any local area think something is correct, they can disregard the experience of thousands and thousands of field practitioners in the practical application of science and technology and the standards that have worked effectively. For example, even though we have specific standards which are evidence-based practices for installing wells and sewage systems while protecting the groundwater supply, if the local community feels that the regulations are too strict and ignores them, sewage may be flowing on the surface and contaminating wells and the groundwater supply. Trust me, over all my years of experience, I've seen so much of this, it's unbelievable. You'll be drinking sewage, folks, not water. Here in Florida and nationwide, the groundwater supply provides millions and millions of people with daily water. Eliminating evidence-based practices is a complete refusal to recognize science and the experience of seasoned practitioners in quest of some dogma. This is repudiation of everything the Centers for Disease Control and Prevention stands for and why they are the #1 preventive medicine agency in the world. One of the major reasons why the United States of America has always been considered to be the #1 country in the world is because of our science and technology. And now to our story. Global warming is similar to a sudden bridge collapse, except that neither one is actually sudden. The bridge has been assaulted by mechanized vehicles, snow and ice, wind and rain, high and low temperatures, age and wear, accidents, and perpetual use over a period of time. The abutment seat, most vulnerable part of the abutment, especially on the bridges, has been weakened, and then one major assault, a severe accident or severe storm, and the bridge suddenly collapses. The same is true of people, especially vulnerable populations of the young, old, disabled, poor, and homeless. Now, all people are affected by environmental pollutants, but these people are simply affected more. All people have been assaulted by biological, physical, chemical, and radiological agents throughout their life with residual effects. And this is what I call total body burden. Whereas the vulnerable populations have potentially greater exposure since they live, work, play, and are educated in probably the most highly contaminated and polluted areas. For the purposes of this discussion, I have added a new definition to the science technology called total body burden. Typically, it refers just to chemicals or radiological agents. For us, and from now on, it should be, this is the total accumulation of the effects of all chemical toxins that you've been exposed to before you were even born. This goes clear back to the fetus. And the accumulated toxins, effects of radiological agents, effects of physical agents, and effects of biological agents from conception to the present time. These have attacked our body, weakened our resistance to disease, and made us more susceptible to the effects of new environmental pollutants, new diseases, and global warming. Global warming is like the very top of this cold pile of coal or a mountaintop. And we have all of these problems that have occurred to us throughout the years of our life. And now we get all of these pressures of global warming on top of it, and it can cause a tremendous deal of sickness and injury. Each one of us has already some level of total body burden and are more susceptible to the effect of environmental pollutants and disease as a result of it. Environmental pollutants and their interactions and how they interact with people, we're going to talk about next. There's a complex interaction between people and environmental pollutants. The same environmental pollutants will affect each one of you differently. And it's because of your age, your sex, your body build, your weight, your previous experience with pollutants, genetic factors, where you've worked, your level of nutrition, your exposure to different diseases. So even though we have the same chemical or the same air pollutant that's affecting us, each one will respond differently. And of course, those who are already ill will become far sicker and they'll be more prone to die. There's another complicating factor with chemicals. When a chemical is released into the environment, they're being constantly released. Every time you put down a new carpet, there are chemicals being released. Every time you get into a new car, there are chemicals being released. From that nice new car smell you smell, there are chemicals being released into the air. Now, these chemicals typically they're not in pure form. They're in a mixture of chemicals. So we really don't quite understand many times what the real effect is on you. Whereas if you had a single chemical, you would. The difficulty here is that by the time it leaves the factory or where it's coming from and it arrives and is deposited on air, on food, on the land, on your body, in your eyes, it's everywhere. By the time that happens, right now will be far more complex and will cause even more disease, and it's more difficult to take care of. Global warming, people have a tremendous misunderstanding about global warming. I've been writing about this since 1982. And in 1982, I was a doubter. By 1985, I was not. And trust me, it is a major problem in our society. This is a major assault on people and the environment, leading to extreme temperature variations, large quantities of water resulting in severe flooding, extreme damage to properties from hurricanes, landslides, wildfires. If you have wildfires, you will have landslides. Because now what has happened is that the roots of the trees hold the earth, and when they're destroyed, now when the rain comes down, it loosens all the topsoil, and it comes down as a mudslide. It's very dangerous. We also have potential elimination of habitat, where people can no longer live. We have contamination of food and water. We have a sharp increase of insects and rodents that lead to even more disease. Good examples are Puerto Rico. Those poor people have been suffering now for so long. It is in Yiddish and Shanta. It's a disgrace that American citizens have to live that way. They're living back in the Middle Ages. It's an absolute disgrace. The floods have disrupted the hazardous waste landfills. And all that hazardous waste that's supposed to be contained is now in the floodwater. People are drinking water from the wells, from the landfill sites. Those wells are there for one purpose, to test to see whether or not more pollution is getting down toward the groundwater supply, which is our drinking water supply. And instead, they have no drinking water, so that's what they're doing. It's a very pathetic situation. If you go to Houston, Texas, the people walking around, you saw them walking in all those floodwaters. They're walking in a microbiological and chemical stew of all of the contaminants that are around. The sewage treatment plants have been disrupted. The water treatment plants have been disrupted. Their houses are severely contaminated. And what are we doing? We're fighting. Should we provide money for these people? It's a very sad situation. I'd like to talk about greenhouse gases and how this causes global warming. Greenhouse gases are the gases that trap heat in the atmosphere, and they allow the heat to flow back into space. Now, usually, when the heat can go back into space, we don't get this increase in temperature in the lower part where we live. The oceans don't start to increase in temperature. they don't start to increase in volume because of the ice packs that are now disintegrating. Well, 84% of these gases are carbon dioxide. And the biggest producer of carbon dioxide is the burning of fossil fuel. And when we go to our new forms of providing energy from the sun and from the wind, we are so much better off. And other countries, frankly, right now are moving way ahead of us because of the nonsense that we see. 9% of these gases are methane, and part of the methane comes from the raising of cattle, and part of it from rice fields and from agricultural fields. Nitrous oxides are produced by industries, 5% of fluorinated gases. Greenhouse gases affect climate change based on their concentration in the air, how long they stay in the atmosphere, and how effective they are in producing global warming. Some gases, such as carbon dioxide, which people say, oh, well, what's carbon dioxide? You know, it's sort of here in the air anyhow. They can remain in the atmosphere for thousands of years. What we do with carbon dioxide is we trap it and we condense it and we send it down through special wells underground, some 6,000 to 8,000 feet underground, and we pack it in areas where the gases cannot get out. And in so doing, you have to be very careful because we're going through the water stratum that we drink. And these, of course, help reduce global warming. Greenhouse gases come from production, transmission, and distribution of electricity. That's the largest source. Also motorized vehicles, off-road and on-road, industries using fossil fuels, commercial and residential properties using fossil fuels for heating, and of course, what we mentioned from agriculture. Climate change results in temperature extremes. People say, okay, we're talking about warming the earth, so why are we having these severe cold spells? The reason for it is that I'm not a meteorologist, so that creates a real problem. I think I'll skip that. I'm getting into areas that I'm not good at. Anyhow, take it as something as a fact that it does affect the cold spells as well as the hot spells. Climate change can affect all people, but also especially the vulnerable people. And we've mentioned these before. And the reason for it is that these vulnerable populations, which we'll talk about in a moment or so, are already in such bad shape that it's much easier for them to become ill and also, of course, to die. Climate change can also create poor air quality in cities. It increases the ozone level at the lower levels. And ozone will be part of smog. It increases the number of climate change of insects and arachnids, causes mosquito, tick, and mouse-borne diseases. Beside all the pollutants, we have emerging and re-emerging diseases, which we don't really pay attention to until somebody gets sick and everybody gets terrified. Travelers are especially at risk for infectious diseases. In 2011, United States citizens made over 85 million international visits. When you go to another country, you're exposed to the viruses and bacteria of that country. That's why when kids go to school or you go to college and you find out that in the very beginning, by your recall when you start out, we have far more colds. That's because Henry is coming from one end of the state, and Henry is subjected to certain viruses, and Sally's coming from the other end, and she's used to those viruses, and you come together and you trade, and guess what? The other people become ill. Well, this is what happens when you travel internationally. So with all this travel now, we've had quite a few problems, and we're going to talk about 4 diseases very briefly. I'd like to also mention that we have a serious problems with antibiotic-resistant bacteria. The Centers for Disease Control said there are 2 million illnesses and 23,000 deaths because of the overuse of antibiotics and the misuse of it. The antibiotics are misused in healthcare because we've used too many of them. People stop using them before they're completed the dose. You should never do that. What the antibiotics do is they start out killing the most susceptible bacteria, and then the least susceptible, when you stop taking them, are now present, and when they grow, they are more resistant. Some examples of problems of diseases is SARS, that's severe acute respiratory syndrome. That's something everybody became very concerned about. That was traveling. It came out of Asia in 2002. It causes severe viral upper respiratory infections. It's found in the respiratory secretions, feces, and blood of infected people. And it's spread by infected droplets in the air and person-to-person contact, and it's similar to pneumonia. And again, this is a disease that we had no knowledge about. Ebola, everybody's heard about it. The panic that went on about Ebola started in Africa, but probably transferred from animals to people. There are indigenous people that eat the meat of animals that have died because they need protein. And when they do that, they are in contact with these viruses, such as the Ebola viruses, these hemorrhagic fevers. And these individuals started to become ill. This was a tremendous failure of the World Health Organization. Why in the world they didn't do what they used to do is beyond me. What they used to do, as soon as they had the first 2, 3, 4, or 5 cases, specialized teams of people went into the area and they stamped it out immediately. And here they just let it continue and continue and continue until suddenly here in the United States we're terrified about Ebola. Hey folks, we're going to have this in the future. We really will. And you can track it to not only all the travel, but also we're going to track these diseases to global warming, because as we warm everything up, insects move from one place to another, especially mosquitoes, and mosquitoes transmit many of the diseases that we will face. Another problem we have is with tuberculosis. People think tuberculosis is gone. No way. In 2013, an estimated 9 million people developed tuberculosis and 1.5 million people died. 360,000 of them were HIV positive. So for them, this is an associated disease. However, people that are admitted to hospitals, to nursing homes, to assisted living facilities, every one of them must have a chest x-ray done, because we do not know who is harboring the tuberculosis bacteria. We have no idea. And right now, the healthcare people, the doctors, the nurses, the staff, are also susceptible to tuberculosis. The Zika virus you all heard about. We had it right here in this county. This is transmitted by a mosquito and it causes birth defects, and we haven't seen anything yet. It's going to continue to get worse. Environmental pollution, infectious and communicable diseases affect all people throughout their lives, especially vulnerable populations such as children, the elderly, those with chronic diseases and conditions, the poor and homeless. I want to talk about the poor and homeless first. The poor and homeless include mental health patients, veterans, women, children, and families who lost jobs and in their homes, runaway children, have greater rates of disease, limited access to health care, and the inability to pay for basic needs and preventive health care. Past housing and foreclosure crises have contributed substantially to homelessness. Global warming resulting in massive storms, heavy rainfall in some areas, and severe drought in other areas exacerbate the problem because of massive destruction of housing, loss of businesses and jobs, and destruction of agricultural areas. Flooding disrupts the lives of all citizens by destroying or disabling, even more so for vulnerable populations, housing and transportation, sources of safe food and water and sewage systems, agricultural and industrial sites, leading to potentially catastrophic contamination, both of a chemical and microbiological nature. I already told you about Puerto Rico and Houston, Texas. I'd like to talk about children. People have a misunderstanding about children. They see them as small adults. They are not. The child is recognized as a distinct entity with varying responses to the environment based on the time of exposure, of whatever they're exposed to, the frequency and quantity of exposure, the physiologically maturity, weight, sex and age of the child, amount and frequency of previous exposures, existing health conditions. When I talk about previous exposures, if the male is exposed to certain chemicals prior to conception, or the female, they can cause a defect in the fetus, which will show up, if not immediately, many years later, all because they've been exposed to certain chemicals. One of the best examples of this was the use of anesthetic gases. The people in the operating rooms using the anesthetic gases would inhale part of the gases because of leakage in the equipment. And studies were done of these operating room personnel and found that there were more miscarriages, more defective children at birth, and also later on in life, even leading to cancer. So at any point in their life, being subjected to chemicals can be very disastrous. Now, children are exposed to environmental pollutants in the home, school, recreational, and occupational areas. This exposure is exacerbated by poverty, homelessness, hunger, poor school and housing facilities, poor medical care, language barriers, and climate change. Children are most affected physically and psychologically by catastrophic incidents such as wildfires, floods, hurricanes, earthquakes, mudslides, whereas you and I are upset by having to leave our home because of the hurricane coming from Dallas County. Kids don't understand this. They don't understand why they're not being protected by their parents anymore. They don't understand what's happening. They don't understand that their lives have been disrupted has a tremendous psychological effect on them. We have other problems too with children. There's complacency today about how we take care of our kids. There's a reduction in good sanitary practices, like what I heard from some idiotic person, that if you drop something on the floor, there's a 10-second rule. Hey, listen, if you pick it up before 10 seconds, it's not contaminated. And then I heard from someone else, oh, it's 15 seconds. I heard from someone, no, it's 5 seconds. Hey, folks, it doesn't exist. The minute it hits the floor, it's contaminated. And every time Goo-Goo is sitting in the high chair and drops that toy, and you pick it up and hand it back to Goo-Goo, you're contaminating her. That's a fact. We have other problems too. We now have something called social media. God bless it. For some ways it's good, and for other ways it's terrible. And we have a group of people that say, do not vaccinate kids, they'll get paralyzed. This is not scientifically valid. It is totally and completely wrong. And every time you don't vaccinate one child, we have something called the herd effect. So if you have about 30 or 40% of your kids, or even 20% not vaccinated, the person who gets the disease, what happens now is that disease goes out like this. So where my thumb goes, you hit someone who's not vaccinated, that person gets the disease. You hit someone vaccinated, they don't. You hit someone that doesn't. Well now, instead of containing the disease, we spread it. And that's why we're having outbreaks of measles that we shouldn't be having any longer. And we're going to have outbreaks of children's diseases that we haven't seen in a long, long time. I'd like to talk about one other thing about kids. Kids are subjected to rats, roaches, insects. I personally have seen kids with rats hanging from them. Shocking. I've been in areas where I ran rat control programs where we killed 30,000 rats in a 60-city block area. These are sewer rats. These are the Norway rats. They're the vicious ones. They're not as bad as, they're not, our roof rats here, or fruit rats, are not nearly as bad. The elderly. A good many older persons, not us obviously, but a good many I've seen in my career, live in homes or apartments that are exposed to roaches, cigarette smoke, other insects and rodents, irritating chemicals, peeling paint, temperature extremes, unsanitary living conditions in the home and neighborhood, violence and crime, indoor and outdoor air pollution, and poor maintenance of the structure. I've seen houses that were built for one family, 3-story house, had 6 people living there, 2 bathrooms. Now they had 6 apartments, 10 people to an apartment, 60 people living in that structure. That's not right. A lot of these older people have the potential for healthcare associated infections, and not only the accidents they have there, and that's because of the unsanitary conditions in the bathroom and kitchen, poor medical care for the individual. Many of these elderly people have multiple chronic diseases and conditions and are also frail. I'd like to give you some examples of environmental issues I've personally experienced, and then I'll explain to you why. In the 1930s and the early 1940s, I lived in South Philadelphia, miles from by the way, that's where the great singers come from. Mario Lanza and Eddie Fisher, and go on and on. I'm not one of them. You hear me in the bathtub, it's terrible. In the 1930s and early 1940s, I lived in South Philadelphia. This was miles from the burning city dumps in southwest Philadelphia. That's how we used to get rid of our solid waste in the city of Philadelphia. And there was intermittent smoke and odors present in the air where I lived, which caused air pollution. And there were times that the sky was so hazy you couldn't see the sun. Now this had to be at least 10 to 15 miles away. So, a pretty darn good example. In 1956, I attended the Pittsburgh Field Training Center of the United States Public Health Service. That's where I first met up with the U.S. Public Health Service, and I've been working with them ever since in the Centers for Disease Control. For the first time I saw gray snow falling from the sky. There were so many particles in the air in Pittsburgh that when it snowed, it was gray, not white. From 1959 to 1963, I was a district environmental health supervisor in Philadelphia. I was responsible then for 250,000 people in all environmental programs at age 26. I worked with every conceivable type of environmental disease problem except for cruise ships, as described in the new book. I even worked with planes that contaminated water and food at the Philadelphia airport. You think your planes are safe, huh? Pittsburgh, Pennsylvania, 1972. I was supervising Indiana State University interns. I supervised over 1,100 interns in 28 states and 70 different jurisdictions over 25 years. It gave me a little bit of experience. I came down from the Pennsylvania Turnpike and entered a cloud of smog over the city, which caused my eyes to tear, nose to run, and made me cough and sneeze while driving. Fifth, while supervising interns at the National Institute of Occupational Safety and Health Laboratory in West Virginia, I saw a black lung from the deceased miner. It looked like a lump of coal. That's what this man's lung looked like. And our lungs have a portion of this from air pollution and will be intensified by global warming. While supervising interns in Rock Island, Illinois, I saw acid mine waste seeping from an old mine down through a small stream and watched it destroy everything in its path. I've been involved in countless outbreaks of disease from food and water and direct transmission, such as Staphylococcus aureus infections, we now call MRSA. When I started out in 1954, I took medical microbiology, and we used Staph aureus as an indicator organism. By the time I started my professional career, we were having outbreaks of staph infections in hospital, which we were able to contain with good practice and with antibiotics. The practice has slipped again. It's really bad. And now we have MRSA, which is a fancy name for having Staphylococcus aureus infections that are no longer controlled by methicillin, which is one of the antibiotics. I could go on for many hours to discuss personal experiences concerning older people. I do want to mention one. And children and the poor, the hungry, and regular citizens, and what they've suffered from environmental pollutants and diseases. I'd like to mention this one because it was such a sad thing. When I was a district supervisor, I was called out to an illegal nursing home. And I went with the supervising nurse, and when we walked in, it was one of these houses that had been set up for a family of 4 or 6 people. And now there were patients on 3 different floors. and there was an attic above it which was half the size of a floor which was full of newspapers. It was a fire, simply a fire hazard. And I walked into this place and I saw blind people, I saw very sick people, I saw for the first time in my life roaches that were live in a freezer. I saw roaches crawling on people. It was so disgusting. At that moment, I had the authority as a district supervisor to put everything on hold. I called my district health officer, we called the police, we called ambulances, we had everybody removed to Philadelphia General Hospital, and we had the woman arrested. She went before a judge, and she had all these people saying, what a wonderful person she is. Look how she takes care of all these good people. I talked to one of these good people, and she said, you know what? She hits me all the time to get my check. That's sad. We still have that going on. I've been in migrant labor camps right here in Florida, outside of Miami, where what you had were block buildings with lots of people living on the floor with a well as their drinking water supply and a piece of wood covering the well that was cracked. And there are sewage units within 50 feet of this well contaminating the well. And there was no ventilation. And because of mosquito problems at night, they had to close. They didn't even have windows. They had wooden boards covering the windows. And there were no window panes, no screens. This is how the migrant laborers were. And not just in Florida. They did it in Michigan and many other places. We have a lot of things that are a problem in our society. The reason I mention these personal experiences is because what you learn in school is the basis for your understanding of your specific professional interests, but also how to think and reason, and how to progress in your life and professional career. It's only after you graduate and go out into your professional career and actually observe and participate in the solution of the problems that exist in our society that you now truly mature and you're able to participate in the wonders of constructing the art of a professional career. We're back again to the art of everything we do and the use of best practices, which are evidence-based practices. Today's dilemma, because of what I presented today, which is based on science, my 62 years of experience, review of over 10,000 documents from my 20th book, the tens of thousands of documents I've studied over the years, and most importantly, the work product of a large number of actual environmental health and protection field practitioners, I can truthfully foresee that there is an imminent danger from environmental pollutants, emerging diseases, silencing science, and global warming, which will seriously affect present and future generations and will seriously affect our economy. Frankly, the abandonment of everything that's necessary to keep the environment in fine shape for future generations and prevent disease, injury, and premature death in the name of promoting the economy is not only a highly false premises, but will set our country back to the time of World War II. Pulling out of international agreements on the environment and health is an enormous economic blow to our society. Instead of being leaders in building the 21st century economy, we will be followers who will see reduced economic growth and greater problems for our citizens. I speak to you about the economy because my minor and my doctorate was environmental economics. Destroying 2 or more regulations for every new regulation is totally and completely scientifically invalid and will have a profound effect upon us The destruction of regulations does not create smaller government, as some people would like to believe. It creates highly dangerous situations that will affect all of us and future generations because the contamination that we allow to go into the air, water, and land in the name of promoting the economy will harm the economy and cause sickness and premature death in our citizens as it did many years ago. And guess what? We will have to clean up the environment again, which is very costly, and we'll have to take care of our very sick citizens. We must not retreat to the past. I repeat, we must not retreat to the past. A clean environment utilizing our scientists and environmental professionals in the field appropriately with proper regulations will stimulate the economy, contribute to our continuing success as the world's leader as we have seen for a century or more. In summary, today as I speak to you at age 84, I'm issuing a call to all citizens of the United States of America, regardless of political affiliations, to listen to the world-class scientists and save our planet while preventing sickness and early death from pollutants and emerging diseases. Don't go back to where we were in 1955. March on through the 21st century as dedicated American citizens, and you will see the economy grow and people will be far healthier. We can prevent the destruction of our present and our future. It is absolutely essential to not only reduce sharply greenhouse gases for people trying to avoid the equivalent of a Category 5 hurricane in global warming, but also to reduce all environmental pollutants in order that they will not cause a serious total body burden. I visualize the environment to be a very large tree with many large branches and smaller branches all being interrelated. The large branches include air, water, land, food, etc., and the smaller branches are the subdivisions of the problems. For each of these subdivisions, I explain the several concerns of environmental pollutants and the best practices in resolving these concerns. And that's right here in this book. I've taken each of the major problems, broken them down into small problems that every one of you can understand. And then the best practices that have come from all these field practitioners, not from Hank Koren, but from all the field practitioners that actually do the work. By understanding environmental problems and achieving environmental literacy, we'll be knowledgeable about problems and solutions to problems. We accomplish this by understanding the facts and not the falsehoods. Let me say that again. The facts and not the falsehoods being perpetuated in our society today. A gentleman looked at that in my back seat yesterday and said, "That's good for firewood." Interesting. We must also have proper budgets based on evidence-based practices, best practice. We must contact our representatives in Congress. That is so extremely important. Contact those gentlemen and ladies there and insist that they protect our environment, our health and welfare for now and for the future. We can become more environmentally literate by reading this book, this practice for environmental health, and we will understand each of the sub-problems and what to do about it. We're not saying this is a problem, we're saying this is what you do. How to handle it. Today I'm the old man planting the seed, but I'm young at heart. Planting the seed to grow the tree that will become a growth of trees, will provide you food, shade, beauty, will also help control air pollutants. This will only be accomplished by you and all the people that you know reach over electronic media and other sources of communications. Thank you for giving me the opportunity and taking your precious time to listen to this presentation, which may have a profound effect on you. And thank you for that.